left side of the transpyloric plane. This is the site of abdominal aorta. So it is tympanic, and you have to move up to symphysis pubis, change the pattern of the palpation into deep by moving the metacarpophalangeal joint in the left lateral position, and flex the knee and then slowly extend the hip. In case of abdominal examination, just let us discuss some positive findings of each of the probable diagnoses you might face. In case of abdominal examination, there are some general examination, okay, inspection, palpation, percussion, auscultation, okay, and some mandatory special examinations. That is, you have to mention those particularly, not examining. That is, to complete my examination, I would also like to examine the hernial orifices, examination of the external genitalia, as well as perform digital rectal examination. These 3 points. Okay. In case of general examination, besides the normal or common examinations that I have shown in cardiorespiratory system, there are a particular point over the chest and trunk indicating towards chronic liver disease. So the stigma of the chronic liver disease will be examined in case of abdominal examinations. Any gynecomastia or any spider nevus, okay, or any jaundice or any scratch marks. Okay. Secondly, if the patient presents with acute diverticulitis. In case of acute diverticulitis, the patient's symptom will be on the left side of the abdomen, particularly in the left iliac fossa and to some extent in the left lumbar region. So before going to palpation of abdomen, you have to ask the patient that if you have any pain in any part of your tummy, and don't mention abdomen, it is tummy, okay? So let me know first that whether you have any pain or not in any part of your tummy. So we all know that if he tells you or she tells you that yes, I have pain in this part, you have to start the examination from the diagonally opposite part, which is the most distant part, okay? So if someone tells that he or she has pain in the left iliac fossa, you have to start the examination from the right hypochondriac region, okay? That is the diagonally opposite. If someone tells that yes, I have pain in the right iliac fossa, you have to better start from the left hypochondriac region, which is the diagonally opposite region. Okay. So in case of acute diverticulitis, the pain or tenderness will be in the left iliac fossa, and there may be rebound tenderness suggestive of localized peritonitis. Other than that, you will not find any positive findings. Okay. If the patient is suffering from acute cholecystitis, there may be tenderness and rebound tenderness over right hypochondriac region, along with some muscle guard, localized muscle guard, as well as there is a special test called Murphy's test or Murphy's sign in case of acute cholecystitis. All the patients are pretenders, okay? So abdominal diagnoses are relatively easier to give in the examination stations, because the patients are just have to pretend for the such as whenever you will press over the left iliac fossa, the patient will show yes, I have pain. So it is just to pretend not to have any actual disease. So it is relatively easier to give any of the diseases, either acute appendicitis or acute cholecystitis or acute diverticulitis in the examination. Okay, because you don't need any patient. And in acute appendicitis, there are some signs, special signs for acute appendicitis. Just some pointing sign or McBurney's point tenderness, Robson sign, Swas test, obturator test. Okay, so these are the signs of acute appendicitis. Okay, and in case of hernia, ventral hernia or paraumbilical hernia, the landmark examination of hernia is definitely calf impulse. Presence of calf impulse confirms that the clinical diagnosis of herniation. Okay. Now, we all know that in the palpation section of abdomen, there are two different parts. One is superficial palpation, another is deep palpation. A very, very, very important advice for your examination is, if the patient tells that he or she has pain in any part of the abdomen and you find tenderness in superficial palpation, don't perform deep palpation in that particular part. Okay, just don't forget this message, that suppose in case of acute cholecystitis, this patient tells that yes, I have pain in the right upper part of my tummy, and you found tenderness and rebound tenderness in case of superficial palpation over right hypochondriac region. So you are prohibited to perform deep palpation over that particular area. Okay, now to start with the abdominal examination. The general examinations are more or less same as the cardiac and respiratory examination. First, you have to examine the hands for anemia, jaundice, and some features of iron deficiency or protein malnutrition or protein deficiency, which are manifested over the nails. In case of iron deficiency, there are flat and brittle nails called chylonychia. This might be associated with a number of alimentary tract conditions, as well as there might be excessive or abnormal whitening of the nails, known as leukonychia, which are the signs of hypoproteinemia. Okay, so you have to examine the nails well, and for palmar erythema, flapping tremor, as well as clubbing. Okay, so I want to repeat the same test again. So clubbing are associated with inflammatory bowel disease or primary biliary cirrhosis or primary sclerosing cholangitis in case of abdominal disorders. Then examination of the pulse is not mandatory or essential in case of abdominal examination, but you have to examine the face well for first anemia, okay, in the lower palpebral conjunctiva, then jaundice, looking towards the hand of yours. Then you have to examine the both parotid region, because bilateral parotid enlargement is a sign of chronic liver disease. Okay, so you have to examine both the parotid regions. Then in the oral cavity, you have to examine for anemia and jaundice. Finally, you have to examine the chest. Okay, you have to examine the chest for presence of any stigma of chronic liver disease, such as any spider nevus or any gynecomastia. Gynecomastia is a very important sign, and mind it, patients with gynecomastia can be found. It will be given either as a part of breast examination or as a part of abdominal examination to exclude chronic liver disease. Okay, so don't forget to look for gynecomastia, obviously in male patients. Now, after these general examinations, we have one left, that is cervical lymph node, which we'll see later, examine later at the end of the station. So